Good evening, everybody. My name is Roxanne Chabot from RBC Consultants. Welcome to the Skin Chat webinar. This evening, we're going to be talking about over-the-counter products for acne treatment and maintenance in Latin America, a review of current clinical practices. As speakers, we have Dr. Carmen Gloria Gonzalez, who's a pediatric dermatologist, and Dr. Gonzalez did her fellowship in pediatric dermatology at the Feinberg School of Medicine in Northwestern University and is a member of the American Academy of Dermatology. We also have Dr. Olga Macias, who's a dermatologist in Mexico City and a fellow in the aesthetic dermatology private practice in Mexico City. We would like to thank our sponsors, CeraVe, for making this educational event possible. Before we begin, a couple of logistic tips. If you're having issues hearing the webinar, you can listen to the presentation using your telephone. Just select phone call in the audio pane and the dial-in information will be displayed. If you're having technical issues or if you would like to ask a question to our faculty, please submit your question in the question chat pane on the right-hand side of your screen. At the end of this webinar, a survey will be emailed to you within 1 to 2 days. We would greatly appreciate it if you could fill it in and send it back to us. Finally, within 1 to 2 days of the webinar, a certificate of attendance and the recording of this webinar will be sent to you. Again, if you want to ask questions to our faculty, please submit your questions using the question chat pane on the right-hand side of your screen, and I've written a little note there so you could see where you need to type in your questions. So without further ado, I am going to pass the floor virtually to Dr. Carmen Gloria Gonzalez.
So thank you so much, Roxanne, for that introduction. And let's go here. So just to warm up, we're going to start with a couple of questions. And the first question goes, in relation to acne, which of the following sentences is false? So let's start with this. Acne only affects teenagers. Acne is multifactorial condition. Acne treatment should always include gentle, clean skin care. Acne sequela like scars might be difficult to manage. And acne involved bacteria, it's C. agnes. So please choose the one that is false. Let's see what it shows. Okay, very, very good. Very interesting too. Guys, you're awesome. We're going to talk a little bit about it continuing this webinar. All right, let's continue. And a second question to see how we go. The use of over-the-counter products, please select one choice. It is widely used in Latin American countries, can help as adjuvant to standard medical acne therapy. Their use preference varies between different dermatologies. One example is salicylic acid. All affirmations are correct. Please decide which one you think is the correct one. And once you're done, guys, you're awesome. Perfect. This is going to be super, super cool and fun. Great. Okay, let's continue. So we're going to talk about it over-the-counter products in Latin American patients. We're going to talk about this review that was developed by a group of dermatologists. And first of all, let me tell you about the objectives that we're going to talk about. First, we decided to talk about 5 objectives in this presentation. First, it is to understand better what is acne and how it behaves in Latin American patients. The second is to discuss the challenges in treatment Latin American patients. Third, it is to review the therapeutical options in the treatment of acne patients. Fourth, discuss the role of moisturizers and cleansers in our patients. And 5, to explore the ingredients of these cleansers and moisturizers and what is the role in a specific and different formulations. So How do we come to this webinar and how do we come to talk about this? This all came to life at the beginning of this year in April 2021 with this publication called Over-the-Counter Products for Acne Treatment and Maintenance in Latin America, Review Current Clinical Practice. It's a work that was developed by 5 dermatologists, all of us Latin American, and we work in this way. So what do we do? Oh, excuse me. There we go. What did we do in order to develop this work? We did the same. We did this. So we wanted to check what was the role of OTC products in the treatment and maintenance in acne in Latin American patients. So 5 dermatologists from Latin American countries gathered to answer these questions. First, what is known about challenges in the treatment and maintenance of acne in Latin American patients? 2, what is the role of OTC products in skincare as monotreatment, adjunctive, and maintenance treatment in Latin American patients? 3, which products are used for acne treatment maintenance? By whom, when, how, and why? 4, is there a need for specific approaches to therapeutic options and skincare using gentle cleanser and moisturizers in the treatment and maintenance in acne patients? When we developed this work, basically, we discussed the literature and we completed a pre-meeting survey. And that is how we were able to publish this work, and we're going to talk about it tonight with you. So just to start talking, let me introduce you about what's going on and how acne behaves in Latin American patients. So as most of you know, acne is extremely common and is, of course, the first motive of consult in dermatology. So just for you to be aware, acne is the 8th most common prevalent disease worldwide. About 650 million adolescents and adults are going to be affected by acne. We know that acne can range from mild to severe, but from those patients affected by acne, 20% are going to have a moderate to severe acne, which is quite important to know because those are the patients that are going to have the most complicated or the consequences from acne. Now, we do know that there is a correlation between pubertal maturity and the severity of the condition. Acne, it is known to be a chronic condition. So it is interesting to know and to be aware that it will affect an important numbers of adults. And this is specifically important in women. Why? Some studies have shown that acne will continue through adulthood. This is a study that was done in 2012 by Perkins, where he followed a group of women that continued through her life with acne. He saw that women between 21 and 30 years old, 45% of them kept having acne lesions. Women from 31 to 40 years, around 25% of them kept having acne lesions. And in the group of women older than 41 up to 50 years, 12% kept having acne lesions. So it is quite important when we talk about acne, we need to understand that this condition can keep appearing through life. So what happens when we talk about acne, specifically in our population compared with the population of the Iberian Peninsula, specifically Spain and Portugal, and why do we want to compare them? One interesting fact is that we do share a common genetic background. So in order to understand what could explain the difference between them and us, a study was developed in 2019, and it gathered more than 1,000 patients. They wanted to study parameters that explain severity of acne. They studied demographics, biological, social, environmental factors, and the potential trigger factors. And these authors saw there was no difference between Latin American and patients from the Iberian Peninsula. They saw that the factors that contributed to the severity of acne were absolutely the same. And those were male gender, cosmetics, age of onset, and signs of hyperandrogenism. What do we know about how acne affects different ethnic types? We Hispanics are the second most affected type with different backgrounds. We know that African Americans are the most affected ethnic group, and we Hispanics are the second most affected, but it doesn't necessarily mean that we have the most severe type of acne. Why do we have to be worried, and why do we have to encourage that people get acne treatment, and why do we have to be aggressive when we face this condition? Because it has a lot of consequences. It is associated with lower self-esteem, anxiety, depression. It produces negative emotions such as embarrassment, humiliation, low self-consciousness. It has an economic impact, not only because of the cost that it has in treatment, but also because it's been proved that patients with severe acne are underemployed. And we know that acne can produce scars, and acne scar treatment continues to be very challenging today. Now let's talk a little bit about the therapeutic options for acne patients in Latin America. So when we approach to a patient and we have to decide what kind of treatment we want to use, most of the time we decide to use different algorithms. One of the most used is the algorithm of the American Academy of Dermatology, which is the one that you get to see here. Basically, we decide which treatment we're going to use based on the severity of the acne. And we can start from topical treatment up to oral treatment being isotretinoin or main standard treatment in the case of severe acne. In this case, there is no specific mention to OTC products and when to use them, but we do know that patients with acne are going to need specific moisturizers and sunscreen as part of the treatment. Now, what happens when we do have other treatments or other different types of therapeutic algorithms? In the case of Latin American countries, Spain and Portugal, we have our own algorithms, and those have been published by an organization called CILAB. That organization does encourage to use OTC products during the treatment of acne. Now I'm going to introduce you to Dr. Olga Macia. She is a dermatologist from Mexico City, and I'm going to let you continue to this presentation.
Oh, we can't hear you, and we can't see you, Dr. Macias. There we go, and we can't hear you yet.
Sorry, you can hear me now?
Now we can hear you. Thank you.
Excellent. Hello, good evening, everybody. It's a very honor to be in here. Well, the polling question is the next. Okay. Which of the following is true? Ceramides are not part of the skin components. Moisturizers can help to control acne. Darker skin are less prone to post-inflammatory hyperpigmentation. Cleansers are not necessary to control acne. And the last one, sunscreens are not necessary to control acne sequela. So you can choose an option. Okay. So, okay, very good. Okay, you studied before our webinar. Perfect. Okay, so, okay, we can proceed to Okay, I'm sorry. Okay. On our pre-meeting survey, the panel members completed a survey on over-the-counter products' role and skincare in acne treatment in Latin America and specifically in their practice. So, the survey examined which over-the-counter products were recommended for acne monotherapy as an adjunctive treatment, and for maintenance. Further questions addressed who uses these products, when, how, and why the products are recommended. Oh, I'm sorry. Okay, so here we can observe, if we can focus on the table, as monotherapy in our patients with acne, as first choice, usually we choose alpha hydroxy acid, beta hydroxy acid serum, ceramides containing foaming cleansers, exfoliating soaps, free cleansers, benzoyl peroxides with or without antibiotic. So, over-the-counter cleansing products were mainly recommended for younger patients at a started level for women with adult acne. The use of these OTC products is similar to practice described in the guidelines. Okay, over-the-counter monotherapy is used for mild acne. When we use adjunctive therapy, it's mainly applied for moderate acne in combination with prescription treatment. Reasons for using over-the-counter maintenance therapy are anti-inflammatory action, prevention of acne flares, oil control, and minimization of scars. We know that common ingredients in acne products like benzoyl peroxide and retinoids are effective, but may cause skin irritation and impair the skin barrier function that it's very important to conserve. So, ceramides containing skincare may offer acne patients benefit to help restore skin barrier function. As an adjunctive treatment, we know that first choices, as you can observe on the table, include ceramides containing cleansers, creams, or serums with BPO, alpha hydroxy acids, adapalene, which is a retinoid, benzoyl peroxide, or niacinamide, which we know it's an anti-inflammatory product. Most of these products were used on the face for moderate to severe acne in combination with prescription products. The over-the-counter products were applied once or twice a day, morning or evening, on the full face or spot treatment for preparation of the skin for other products. Skincare additional to acne treatment is important because acne-affected skin may be more prone to irritation resulting from acne treatment. We know that systemic and topical medications such as retinoids, antibiotics, benzoyl peroxide are associated with skin barrier alteration, causing irritation and dry skin conditions. We know that these unwanted effects can reduce adherence to treatment and therapeutic outcomes. Over-the-counter non-comedogenic cleansers and moisturizers have been successfully used to reduce skin irritation. Also, we know that products with a high pH are shown to interfere with the efficacy of topical treatments. As maintenance treatment, we know that first choice included cleansing gels, creams, or serums with BPO and alpha hydroxy acids, beta hydroxy acids, or an over-the-counter strength topical retinoid. We know that most of the products were used on the face for moderate to severe acne in combination with prescription products can cause irritation. So, over-the-counter products were applied to help to prevent acne flares, anti-inflammatory, anti-follicular occlusion, control oily skin, and minimize scars. The importance of this table is at the bottom here because we know, and as if we remember, the action or features of benzoyl peroxide, salicylic acid, glycolic acid, retinoid, azelaic acid. But the importance of this table is that we need to remember that ceramides containing cleansers or moisturizers, it's here. You can read it that ceramide containing skincare regimen supports the removal of excess sebum and debris on the skin surface and improves skin barrier, that it's a moisturizing function. So here is a summary of the types of over-the-counter acne treatment. We know that benzoyl peroxide, salicylic acid, glycolic acid, retinoid, okay? We have different type of vehicles as creams, gels, lotions, washes that can treat mild acne, moderate acne, or can be used monotherapy or as an adjunctive treatment or a component of fixed combinations. We need to remember that all these ingredients may cause irritation. So, on the next slide, we need to remember that ceramides containing cleansers and moisturizers, if we understand that acne affected skin may have reduced ceramide level, reducing in skin barrier dysfunction, which correlates with hyperkeratinization and comedone formation. So, ceramides containing skincare regimen supports the removal of excess sebum and debris on the skin surface and improves skin barrier function. We need to understand that compromised skin barrier integrity in acne patients develops a dry skin. So, when we have a patient with dry skin, due to the treatment, such as topical retinoids, alpha, beta, hydroxy acids, benzoyl peroxide, other skincare products, other procedures, or lightening creams, we're going to develop a dry skin. So this is a very problematic in darker skin types that also we have in Latin America patients. Why it's that important? Because that can increase the risk for post-inflammatory hyperpigmentation. So when using topical therapies in patients with darker skin types, irritation like retinoid dermatitis can result in pigmentary sequelae. So if we choose more tolerable formulations such as creams, lotions, aqueous gels, irritating ingredients, we are going to decrease the risk of dry skin and irritation. I'm sorry. Okay. Oh, I'm sorry. So, the guidelines and algorithms nowadays are pretty heterogeneous. I'm going to recommend the algorithm for acne treatment performed by the Ibero-Latino American Consensus, in Spanish, CILA. The importance of this research is that this algorithm incorporates skincare and sunscreens as an essential part of acne prevention, treatment, and maintenance, and recommends daily use of low irritant and non-comedogenic cleansers, moisturizers, and sunscreen to reduce adverse events such as dryness, erythema, photosensitivity, and post-inflammatory hyperpigmentation. Okay, next slides are going to be by Dr. Carmen.
Okay. Thank you so much, Olga. And here I am back. So just summarizing a little bit, we saw that there are many types of OTC products that they can cause problems because they can cause irritation and that. And we saw that from the different types of treatments that we can have, we can also see, excuse me, let me just put here. We saw that we can also see that some of the OTC products that we can use are going to be helpful in repair the skin barrier. And why do we worry so much about this? Because we do know that acne patients have a couple of features that are important to correct. The skin barrier in acne patient is damaged. There are three things that prove that. First, acne patients have low ceramide levels, and let me show you how it goes. There are many skin conditions that have low ceramide levels. We know that psoriasis, ichthyosis, eczema have low ceramide levels, but also does acne, specifically ceramide 1. What happens in acne? We do know that even they have a higher sebum excretion that the sebaceous glands enlarge, there is a change in the types of lipids that are secreted. We know that there is a lower proportion of free fatty acid, linoleic acid, and ceramides. So I want to show you the table of the right side of the slide. If you take a look, these are levels of ceramide. If you take a look at the green bar, that's the normal levels. The blue and the light blue, those are the ceramides of patients with acne. So we see that they're lower. The light blue, those are patients with moderate acne. So it means that the more advanced the acne is, the more severe it is, the lower are the levels of ceramides. Another thing to keep in mind, as we said, we know that ceramides are low in patients with acne, but we do know that also the barrier function is diminished. And another way to measure that is by measuring transepticular water loss. If we look at the table of the bottom of the slide, we will see that TEWL, which means transepticular water loss, we can see there that says acne patients, moderate, mild, and control subjects. And I want us to look at the number there. We get to see that the controls have a lower number, which means that they tend to lose less water through the skin, which is good. We don't want the skin to lose water. But patients with acne lose more water. And the worse the acne is, the more water do they lose. So that means that they have a worse barrier function. Let's keep looking at the things that we find. The same study also shows that ceramides level keeps being lower in patients with acne, and this is even more evident as the worse the acne comes. So just to reinforce the idea, when we read in the upper table, the total ceramides keeps being higher in normal patients and lower in patients with acne, and the lower they go as the acne goes up in severity. Another parameter that we need to look and observe in order to understand that the skin function and the skin barrier are working fine, it's pH. So we know that skin in the patients with acne have lower ceramides. They get dehydrated because they have not the ability to retain water. But we need to see how is the pH work, because the pH, it's very important to allow the skin to repair and produce ceramides and different kind of proteins. So in this study, they wanted to see how was the pH of females and males. That is why we have two graphics. The one in the left is males, in the right females. And they compare basically acne patients against normals. And independently from sex, they saw that patients with acne tend to have higher levels of pH. And that means that these patients probably have a difficult or a more complicated mechanisms of skin reparation, because the skin needs to have low pH. So that is also very interesting. It means that the skin in patients with acne has the three functions of the skin complicated: ceramides, transepticular water loss, which means dehydration, and the pH, which is also very important in the reparation of the skin. So now I pass the word to Dr. Olga. Here I leave.
Hello again. Can you see me now? Well, oh, I'm sorry. Okay, so it's very interesting when we explore the moisturizer and cleanser ingredients that offer insights into the specific role of common ingredients in moisturizer formulations. Why is this important? Because when we treat patients with acne, we are in a dilemma. Why? Because the skin of acne patients, as Dr. Gonzalez explained, may be ceramide deficient. When in contact with harsh acne treatments, like as you can observe on the slide, retinoids, salicylic acid, benzoyl peroxide, applied in a skin that it's redness with irritation, discomfort, peeling effect, dryness with sensitivity, and the irritation, it's a mess. I recommend the audience to read this very interesting article of Dr. Drino, which is very useful to understand skincare for acne patients. So, Bagatin et al. At Annal Brazilian Dermatology, they published that daily application of fragrance-free, non-irritating and non-comedogenic cleansers, moisturizers, and sunscreen may reduce adverse events such as our dilemma: dryness, erythema, photosensitivity, and post-inflammatory hyperpigmentation resulting from topical drugs that we use for acne. Special consideration should be applied to acne patients prone to this post-inflammatory hyperpigmentation that we have very frequently in Latin America because we have a lot of skin of color patients. So using the appropriate skincare helps to minimize irritation. Okay, so what does an ideal cleanser and moisturizer look like? This is an topic product. It needs to be safe, effective, cost-effective, additive-free, fragrance-free, sensitizing agent-free, obviously pleasant to use, should increase lipid and water content of the sperm corneum, and patient satisfaction. We need to remember that all topical formulations that we choose, they can have risk for irritation, and that depends on product pH. So we can have acidic product, neutral, or alkaline product. The risk for irritation of acidic products is low, neutral is medium, okay, and alkaline is high irritation. So we need to use cleansers and moisturizers close to physiologic skin surface pH between 4 to 6. So they may reduce skin irritation and improve skin barrier function. Sorry. So the preferred over-the-counter products for acne, if we are thinking about cleansers that do not contain soap, and they need to be with a near physiological skin pH, and moisturizers can be used to improve both topical treatment efficacy and tolerability. The preferred over-the-counter products are cosmetically elegant. We understand cosmetically elegant as texture, non-irritating, well-tolerated, anti-inflammatory, and should help to restore the skin barrier function. Irritating cleansers may be the most appropriate type of cleansers for skin of color, acne-prone skin, or those with acne, as they are associated with a low risk of skin irritation. Effective moisturizers typically include ceramides, humectants, emollients, oil absorbers, or have anti-inflammatory and barrier replenishing properties. As an adjunctive, skincare can play an essential role in preventing, treating, and maintaining acne. When we're selecting a cleanser or an moisturizer for acne and acne-prone skin, individual and/or cultural variations in skincare preferences should be considered. Because some skincare and haircare products, such as cocoa butter, which is very popular nowadays, and petrolatum may exacerbate acne. So, Linde et al. Published a consensus paper that stated that dryness and skin irritation resulting from acne treatment could be improved using ceramide-containing cleansers and moisturizers, enhancing treatment adherence. The authors proposed that the skincare regimen should be an essential part of the acne prevention, treatment, and maintenance care regimen. We know, and nowadays we understand, that the skincare is a necessary part of acne treatment and is part of various acne guidelines. We know that not all moisturizers are created equal. We know that petrolatum it functions as an occlusive barrier, so it reduces water loss. Dimeticone, it's a film former. It helps to create a protective barrier. We know that glycerin or sodium hyaluronate is an humectant, so it helps to bind water. Also, we know that triglycerides, ceramides, the most important ceramides of the stratum corneum, it's NP, AP, and EOP that we know as 1, 3, and 6.2, which are physiologic lipids that are components, as I mentioned previously, of the stratum corneum lipid matrix. Okay, others like cetyl alcohol and others are emulsifiers, and we have vehicles like multivesicular emulsion that trap ingredients into oil or water layers and releases them slowly. What is this? We know that CeraVe technology, all the formulations of CeraVe technology includes ingredients that benefit skin barrier. They include ceramides, they are fragrance-free, they are non-irritating, gentle on the skin, and they are hypoallergenic. Most of them contains hyaluronic acid, this MUVE technology, and they are non-comedogenic. They are parabens-free, sulfates-free, dyes-free, propylene glycol free, and mineral, nut, and coconut oils-free. What is MUVE technology? Okay, so it is defined as multivesicular emulsion system. It is a multi-phase oil in water emulsion system consisting of a series of concentric spheres of oil and water phases. MUVE traps ingredients into its oil or water layers and releases them slowly, layer by layer, into skin over the time. So, progressive release of moisturizing ingredients versus quick burst of traditional emulsions develops a better, prevents the water loss that we have on our acne patients. On another topic, we know that our patients with acne are they do not want to use sunscreen because there is a myth that sunscreens can worsen acne. But we know that sun exposure is a contributory factor to post-inflammatory hyperpigmentation of the lesions. We know that this is particularly in higher skin phototypes who may not normally wear sunscreen and do not realize the darkening effects UV irradiation has on post-inflammatory hyperpigmentation. So, as doctors, also we are educators. So, we need to encourage the daily use of a broad spectrum sunscreen with a SPF at least 30. We know that sun protective measures like sun avoidance and wearing protective clothing. Also, we know that encourage the intake of foods rich in vitamin D, like salmon, fish liver oils, and fortified foods, and vitamin D supplementation could be help acne. This is a very interesting publication on April 21 on the Journal of Drugs in Dermatology by Dr. Baresi. The group studied the alteration to the skin barrier integrity following broad-spectrum UV exposure in an ex vivo tissue model. Here it's a resume. Here we can observe the H&E staining. Okay. On this part, we can observe that the skin model were irradiated with 20 centimeters, actually per 5. So we have 100 joules plus SPF 50. Okay, and in laminin 5 staining, we can observe that the tissue morphology, the reduction in the number of apoptotic cells, and the minimized dermal epidermic disruption is conserved because we use sunscreen. On the next slide, another published by Dr. Baresi too, we can observe that when we use moisturizer and sunscreen, we improve the reduced stratum corneum cohesion, the reduced lamellar bodies, we diminish the apoptotic cells and disrupted desmosomes. So, what is the most important thing that we recommend to our patients? If we use a very good moisturizers with ceramides and the correct use with at least 30 SPF sunscreen, we can improve the photo damage in acne patients. Okay, so in this part of the slide, we can observe skin with no exposure, that's mean a control, patients with ultraviolet only, patients with applied only sunscreen, patients that applied only moisturizers, and patients that applied sunscreen and moisturizers. Day 1, day 7, day 14. So the most important is that when we recommend patients to use sunscreen, we can develop erythema. So you can observe here, okay? But if we observe patients that use moisturizers and sunscreen, the erythema is lower. So this is a very important research that in previously data, we do not know the importance of the skin barrier integrity plus sunscreen use. Okay. So, as conclusions, we know that acne is associated with skin barrier dysfunction, which presents with a reduced water binding capacity due to multiple factors.
We do know that treatment can exacerbate this dysfunction, leading to dry skin irritation, which in turn lead to poor treatment adherence and suboptimal outcomes.
We know that over-the-counter monotherapy is used for mild acne, and over-the-counter adjunctive therapy is mainly applied for moderate acne in combination.
Oh, sorry, that was me.
Yep.
Sorry.
No, it's okay. And suboptimal outcomes.
Okay, here I go. So reasons for using OTC maintenance therapy are anti-inflammation, prevention of acne flares, oil control, and minimization of scars.
Okay. Common ingredients in acne products like benzoyl peroxide and retinoids are effective, but may cause skin irritation and impair the skin barrier function.
Non-comedogenic cleanser and moisturizers can improve dryness and anti-irritation from acne treatment. Favor aqueous gel, lotion, or cream-based.
We know that acne-affected skins has shown lower levels of ceramides, with profound reductions compared to healthy individuals of all ethnicities.
And finally, ceramide-containing moisturizer may enhance adherence and complement exciting acne therapies. Now I'm going to the last. Let's see. There we go. Okay. Let's see.
You need to vote.
Let's see the results.
Oh my gosh, they're awesome.
Yeah. They put attention on our webinar. That's really good.
Wonderful. Well,
Wonderful. Yeah.
well, thank you, Dr. Gonzalez and Macias. That was a really insightful and interesting presentation. And now we can have time to go to our question period. Again, to our audience, please submit your questions using the question chat pane on the right-hand side of your screen, and any additional questions can be submitted to info@rbcconsultants.com. And thank you again to our sponsors, CeraVe, that have made this educational event possible. So let's go to our question. So we have a couple of questions from the audience. What is the suitable skincare for oily skin? Who would like to answer?
Go, Olga?
Say it again, please. Could you repeat the question?
What is the suitable skincare for oily skin?
Yeah, of course. Okay. Well, for Latin American patients, what I will recommend is, first of all, a cleanser. Okay. I thought that cleansers with benzoyl peroxide or with glycolic acid at low concentration could be really great. 2 times per day. After that, I think in order to control oily skin, we need to use a retinoid, and obviously we need to use a moisturizer with ceramide, plus maybe niacinamide 1 or 2 times per day, and obviously sunscreen.
Anything to add, Dr. Gonzalez?
Well, first I would say that be very sure that you have greasy skin. Probably most people have mixed. I don't know if that you have seen that in your practice, or most people think they're very greasy and they have mixed skin, and not overdo. Okay, that's important. Not overdo. Be respectful of your skin. When you cleanse your skin, we have talked about this a lot in the CeraVe events this year. Remember that using gentle cleansers is very important. You just need to do it twice a day with warm water, and you just need your hands to do that. And basically choose a good cleanser. And if you're thinking oily skin, probably a foam. I would choose a foam. And the rest I agree with Olga. I think I have nothing else to add.
Great. Also, this is an interesting question. Should we apply the moisturizer before the acne topical medication or after? That's a $100,000 question.
That's an interesting question. That's
Yeah,
a
it
very
is.
interesting question.
Yeah. Yeah.
Who would like to go first?
Please, Carmen, go ahead.
Okay, that's an interesting question. First, I've never read a study that says A is better than B. First, I've never read that. I do know that you don't want to put your retinoid when your face is wet. You don't want to put it there.
Yep.
I do know that you don't want to put a lot of retinoid. I do know that you want to put it at nighttime. And I know you want to start using it probably every other night and small amounts. I know that maybe, I don't think it'll make much of a difference, because if you think how retinoids act inside the cell. They go to the nucleus of the cell. There are some receptors there, and that's where they act. So thinking basically, is it going to make a difference? I think maybe using it after could help you to treat the irritation that could have happened as an effect from the retinoid would be better. But I don't really see that using it before would change too much, because since the retinoid is going to act from inside the cell out, to me it makes more sense to use it after. So you get to treat the side effects, not prevent. And I don't know, maybe because I said I've never read anything about it, but it's a good question. I admit that I don't know. What do you think, Olga? I don't know.
Yeah. When I recommend the use of retinoid, I think two things. First of all, the weather. I live in Mexico City. Nowadays it's a little bit humid, but in November, December, January, February, we have a very dry weather. So patients their skin is a mess with retinoids. So I prefer that they applied, first of all, a light moisturizer with ceramide in order to tolerate the retinoids. When the weather change, okay, maybe we can switch it, right? But depends on the severity of acne. Patients with mild acne, that's a very good formula. But patients with severe acne or moderate acne, I prefer, first of all, to apply the retinoid and after that the moisturizer, because the effectivity it's better, but I don't know if we have an enough data in order to recommend that. It's like an expert opinion in between our countries.
I'm thinking that maybe when this question came, it's thinking maybe the question goes to what do we want? Because if you think that the retinoids are necessarily going to cause irritation, maybe that people wants to put before the moisturizer. Yeah. But it happens, in my opinion, that if you use the retinoids well used in the potency that you know how to use, in the amount, you can probably prevent that. So I think first is choose the right retinoid, use it how you need to use it in the right patient, because most of the times what I've seen is that irritations comes from wrong use. So maybe this question has a root back there, coming from, is it better to prevent irritation from retinol using the moisturizer before or after? I think that's the question behind it, is how do we prevent irritation from retinoids with moisturizers. And I think the question should come even from the back of our heads, should come, okay, how do we prevent this? We should prevent it by using the right retinoid, the right amount, the right days of the week, because there are also many retinoids that we can use. They're stronger, milder. I don't really know, and I think it's a good question. I don't really know if using the moisturizer before or after would make a big difference. Maybe it will. I really don't know. I don't know.
It sounds like a clinical trial is
interesting. Yeah.
future here.
I have a very heterogeneous type of patients, because I have a lot of like European skin patients and a very oily or greasy patients with different phototypes and the same type of acne. You know, example, mild acne with sensitive skin, and it's like, okay, you can use moisturizer first. And you first apply retinol and then moisturizer, and it's the same type of acne, but the same age, different type of skin phototype and their genetics and maybe their diet, and that's all the importance about this. Yeah.
I don't think there is an answer. I'm sorry.
Yeah. I agree.
So another good question that maybe there is an answer is sunscreen for acne prone skin. Sunscreen, what is an appropriate sunscreen for acne prone skin?
For acne prone skin. Okay. Here we have a lot of formulations with light concentration of salicylic acid. It's still an emulsion, but it's very I don't know how to say in English. Mattifying effect. Without color or with color, but it has to be very light. I don't know, Dr. Gonzalez.
Yeah, I agree with you. The good thing right now, there's so many choices. I always say that if someone tells you I don't use sunscreen because I don't like it, it's because you have not found the right one. Because there's so many choices right now that actually it's amazing the types that you can find. You can find them in almost every type. Basically, if someone has acne prone type skin or oily skin, we always try to encourage them to use gels. There are some, like Dr. Macias was telling, there are some that have some components like they absorb, sebum or things. They're useful for that. Try to be non-comedogenic always, lightweight, etc. But I think it is good to find a good sunscreen because you need to encourage the patient to use it. But there's so many options right now. Like she was saying, you can also put some active ingredients on them, like salicylic acid is a good one. I mean, I really like that. You can use in women's, you can use, there are some types that are like compacts with color, and there's so many options. So you just need to ask your dermatologist, and probably just with a couple of questions, knowing the things that you would like to have in your basic routine, you can get a good advice and find a good product for you.
Yeah, what I said to the patients is that if you like purple sunscreen with pink unicorns, we can
absolutely.
We have a sunscreen with that.
There is one for you. Yeah,
it's not an option not to use sunscreen, because it's also, we need to remember that sunscreen it is the best anti-aging cream. And if we tolerate and if we choose the best sunscreen for our skin, if we are in high school, or if we are 30 or 40 or 15 years old, it's the best anti-aging cream we can use all our lives.
Sure. I agree 100%.
Great answer. Well, that's all the time that we have. So again, Dr. Macias, Dr. Gonzalez, thank you so much for an insightful presentation. It was great and really relevant to today's clinical practice. And thank you all for joining us this evening. Good night.
Good night, everybody. It's a very honor. See you. Bye.